Hello and welcome to Elkin Natural Health Center. My name is Dr. Colin Elkin and I'm a chiropractor, and I have been a chiropractor since 1993. I graduated from Canadian Memorial Chiropractic College in Toronto, Ontario, and along with my wife we run this office here in Brantford, Ontario, Elkin Natural Health Center. And you know, it's interesting when I talk to a lot of people about chiropractic or patients that come into our office. Most people really go to a chiropractor because they have some sort of condition, whether it be pain, like back pain or headaches or neck pain. But really there's so much more that chiropractic can offer, and that's what we really try to promote here in our office. You know, I live a chiropractic lifestyle myself, which involves having my spine and nervous system checked regularly, nutrition, exercise, and really bring a maximized lifestyle into everything that I do. And so that's what we do here in our office, everything from spinal examination to nervous system examination. We have a computer and a scan where we take somebody's spine and scan up and down the spine to see how the nervous system is actually functioning. We do x-rays here in our office, as you can see, and we really take a whole broad spectrum approach on the whole a lot of different aspects of health. So that's our main focus here at Elkin Natural Health Center. So when somebody comes in for their initial examination, and some of you may be tuning into this video for the first time or never having been to a chiropractor before, you know, my goal is to help you to feel comfortable. Myself and Dr. Kim, we want to make you feel part of our family here at this office. You know, there's nothing that I would do for any patient that came to see me that wouldn't be anything different than what I would do for my own family. In fact, my mother and father, my sister, they all come here, my nephews, they have their spines adjusted regularly. We've sat and talked about their specific health concerns and got them on a program of care. You know, our goal is to help you to live the lifestyle really that God intended you to live from the inside out. That's really where health comes from, it's from the inside out. It's a philosophy. So we base our entire practice on a philosophy of healing comes from above down, inside out, as opposed from trying to gain health from a pill or taking something out of the body via surgery. So it's really a different approach than a medical doctor would come from. Hi, I'd like to give you a little demonstration on really how we would care for a patient. This is a pretty standard type of adjustment. Paula's got some pretty specific health concerns. She's our patient here, and she's volunteered to let us do our adjustment on her on camera. So with Paula, with a curve in her spine, we try to make specific correctional adjustments to her spine. You know, chiropractic is not just randomly moving the spine around or randomly, you know, it's not a massage, randomly quote-unquote cracking the back as most people would call it. We try to make very precision, specific chiropractic adjustments to her spine to achieve some sort of desired outcome. So here we are with Paula. I'm going to make a specific adjustment to Paula's spine. And as I do that, I feel for certain areas that are subluxated. In other words, those spinal bones are out of alignment, and they are going to be choking the spinal cord or crushing some of the nerves. So we want to make a specific correction to Paula's spine. Take a deep breath for me, Paula. That's it. All the way up. That's it. Good. Excellent. That's great. Now sometimes, of course, when we make a correction like that, you may hear a little pop or a little cracking noise in the spine. Now realize that nothing is cracking, nothing's breaking. What that noise is gas escaping from those joints, and that allows the spine to move back into its proper position, taking all kinds of pressure and stress off that spinal cord and off that nervous system. There's all kinds of different ways to correct the spine or adjust the spine, and in Paula's case I use a very specific corrective technique to try to reduce the curve in her lower back. And I use the drop piece in the table. This table has mechanical drop pieces. And what I do is I get very specific on her lower spine and drop through. It's very comfortable, it doesn't hurt, it's very safe. Good. That's great. Okay, wonderful. Okay, can you lay right in your back for me, Paula? Okay. So to adjust Paula's upper spine or her neck, again, we're looking for areas that are subluxated, and Paula has a very specific abnormal curve in her neck, which means her neck is too straight. It should be a nice normal, what we call lordotic curve, or nice arc in her neck. So Paula doesn't have enough arc in her neck, so I'm trying to correct that over time. And to adjust her, Very simply, I just turn her head in a certain position here. It's very comfortable, very easy, specific adjustment. And I find that area that's subluxated, that spinal bone. I just make a little adjustment to that area, and we get a nice little release. Wonderful. Great. Power's on, Paula. Good job. Can I help you up?
Thank you.
Great. And so that's it. As far as an adjustment goes, it's very quick. It doesn't take a lot of time. It's very specific and very gentle, very safe as well. So here's another example of an adjustment. This is Diane, another patient of mine. And same sort of thing as I talked about with Paula is that Diane has some specific concerns in her spine, some specific subluxations, which of course have caused some discomfort, caused some pain. But more importantly, they can affect nerves which go to different aspects of the body or different organs, causing those organs to start to dysfunction and create disease. So that's why it's so important to have your spine adjusted on a regular basis so those nerves are working at 100% all the time. Diane gets adjusted very regularly, sometimes 2 or 3 times a week, and has been for approximately 11 years now. And she's in great health. She looks a lot younger than what she actually is. That's a compliment, by the way. And she does really, really well with her regular adjustments. Okay. One more time. Take a deep breath for me. Okay, can you lie on your left side? So I'm going to come to this side of the table. Now this is a little different technique that I used, than I used with Paula. This is a side posture adjustment. Again, it's very gentle, very safe, and very comfortable. Okay. Let's try that one more time. Okay. There we are. Perfect. So we got a nice little release in Diane's spine where that subluxation was corrected. That bone is now moving a lot freer. We've taken some pressure off those nerves, and that allows the body to heal at a much higher efficiency. Can you lie right in your back for me? Okay. Good. Now in Diane's case, I use a little more of a deeper adjustment in her upper neck to get some areas moving here because her upper spine is very locked up at times. It's really subluxated. So to adjust this side of her spine, and as I mentioned, these spinal bones get very, very locked up. I use a little more force here and a little more quickness to get this area to move. Good. How was that?
Oh, good.
Good. Excellent. Okay, you're all set. Power's on. Good. And that's it. Great adjustment.